Hey there, Dr. Brad here from Kids Eating Broccoli Podcast, drellisor.com. Today's topic is ADHD actually a sleep problem? This is a study that's been making the rounds in the media, and so I thought I'd address it a little bit. There was a study that came out that suggested that, or it actually showed, that in some kids, the production of melatonin, which is the important hormone that allows us to sleep, to go into the deeper sleep cycles, is actually starts being produced later into the evening than the kids that aren't diagnosed with ADHD. And so this researchers, or the people reading the research, had the bright idea of, what if ADHD, at least in some of these kids, isn't really the problem? The problem is really that they aren't sleeping and they're chronically sleep deprived. And so now they have things like inattention and mood swings and violent behavior, and are unable to focus in school and sit still because they're chronically sleep deprived. So it's an interesting concept, of course. I mean, I think it brings up a couple of things. And one of those is the idea or the consideration that what we're calling ADHD in a lot of kids really maybe isn't ADHD at all. And why this can happen is because the diagnosis criteria for ADHD, actually much like almost all psychiatric conditions, psychological conditions, has no real objective measurement. There's no blood test for it or anything like that. It's just basically a series of questions that, if answered correctly, in the direction of ADHD, they get diagnosed. So if being chronically sleep deprived can give you similar symptoms to the so-called disease or condition of ADHD, is it possible that a lot of these kids are being diagnosed with ADHD just because they can't sleep at night? And then if you take that to the next level, that the drugs that are being prescribed to these kids for ADHD are actually, in a lot of cases, stimulants. I mean, Ritalin, one of the most popular ones, is chemically very similar to street drugs like methamphetamine and cocaine. And so it's a high stimulant, and that's why these kids can focus. But it would sort of make sense if you're chronically sleep deprived and then somebody gives you a stimulant drug, that it's going to alleviate those symptoms, at least in the short-term temporary state. It's kind of like if you're tired and you drink some coffee, right? You feel less tired and you're better able to focus. Well, same idea. So then that brings up the situation of like, wait a minute. So now we're talking about, we have kids that are sleep deprived, and we're drugging them for symptoms of a condition that's really just sleep deprivation. I mean, that's crazy making, right? What are we doing in the first place drugging these kids in a lot of cases? But, there's that. But then on the other side of that is, if you're giving these kids stimulant drugs, powerful brain-altering stimulant drugs often, don't we think that there's a likelihood that maybe that's interrupting their sleep? So when we study these kids, their sleep cycles are interrupted. And then what if you back up even one step further and look at what's going on, that the levels of ADHD and ADD and these type of things symptomologically, like kids with these symptoms, is so much on the rise. Like, what's going on with that, and why are we seeing that? And the truth is that typically it's a matter of an imbalance in the nervous system between the parasympathetic and sympathetic, or what's called our autonomic nervous system, or our brain is out of sync. And in a lot of cases, that's as a result of brain inflammation or dysfunction in our nervous system as a whole. And that's why at the Kids Eating Broccoli podcast and with my work with drellisor.com, we focus so much on nutrition, because so much of the brain inflammation that we're seeing in kids these days comes from the toxic crap that's being passed off as food in our culture. So could it be that when we feed our kids toxic, crappy, processed, artificial flavored, artificial dye, excitotoxic, heavy metal laden, glyphosate smeared food, that then they can't sleep as well because now their autonomic system is dysfunctional because their brain is inflamed, and then they're sleep deprived, and then their brain's inflamed, and then there's too much gas pedal, too little brake pedal in the function of their brain and nervous system, and then they're freaking hyperactive and can't sit still in a classroom, and then we give them a drug. It's kind of crazy, huh? So I just have been seeing this news report and wanted to jump on and sort of give my stream of consciousness about it. So those are my thoughts. There's a lot of natural things we can do to help our kids sleep. Sleep difficulties are at an epidemic proportion in our culture, not just with kids, but adults as well. Walk into any drugstore and you will find a whole aisle devoted to over-the-counter drugs to help you sleep. Right next to the whole aisle of over-the-counter drugs to help you wake up. But it's also true with our kids. You know, we have a lot of things we've built into our culture that really interrupt our sleep cycle. Artificial light, screens at night, high, sympathetic, dominant stuff like, violent TV shows, violent video games, get the brain functioning in that fight or flight mode. So it makes sense it's difficult to fall asleep. So there's a lot of tactics, a lot of strategies you can use to get better sleep at night, which we can certainly cover in future topics. So that's the deal. Also, tomorrow, 12 p.m. Eastern, so 9 Pacific, I'll be on the Truth About ADHD Facebook page. So go on over there, just type in your search bar in Facebook, The Truth About ADHD. You'll find the page, like and follow it. Tomorrow at 12 Eastern, 9 Pacific a.m. I'll be being interviewed on that. We're going to talk about nutrition for kids with ADHD. We're going to do some question and answer. Should be a lot of fun. It's exciting. That's the website for the movie that I'm featured expert in that should be releasing within the next few weeks. So go and check that out tomorrow. All right. You guys take care, and we'll see you next time.